World Health Day, a global campaign dedicated to raising awareness about cardiovascular diseases and the world leading cause of death. According to the World Heart Federation, heart diseases and stroke claim more than 20 million lives every year. Many of them preventable through healthier lifestyle, better healthcare access, and stronger public health policies. Now, this year's theme focuses on empowering individuals and communities to take charge of their heart health by promoting physical activities, healthier diets, and of course, regular screenings and tackling risk factors such as high blood pressure, tobacco use, and obesity. Talk about the significance of the day. We're now joined by Sister Juandre Watson, Health Promotion and Health Risk Assessment Program. She's, of course, a team leader at the Heart Federation. A very good evening to you, and thank you so much for making the time.
Good evening. It's a pleasure to be here.
Yeah, I would imagine as someone that works directly with patients, and the question then is, what common lifestyle habits or misconception about heart health do you encounter most often?
Thank you. So, as a nurse, I often encounter misconceptions that heart disease only affects older people, when it affects younger adults as well. So, due to the rise of risk factors like your obesity and type 2 diabetes, even in the younger age groups, young and middle-aged people can develop heart problems. So another misconception is that having a family history of heart disease means that they will have the same illness in their lifetime. However, there are many behavior modifications that can be implemented to reduce that risk.
As a federation, I'm keen to know what are you getting on the ground in terms of the importance of physical activities in preventing heart diseases, and what challenges do people face in staying active, in your view?
So, physical activity is one of the most important tools in preventing heart disease and also improving overall cardiovascular health. Uh, its physical inactivity is closely linked to the rising rates of obesity. However, many South Africans do face challenges staying active. It includes like your urbanization, long working and commuting hours, excessive screen time, limited access to safe spaces for exercise, all of which make it difficult for many to stay active. Even when people understand the benefits, daily survival pressures sometimes outweigh prioritizing exercise. So today on World Heart Day, we would like to encourage how important it is to incorporate movement into our daily lives, to safeguard heart health and to boost general well-being. Staying active is one of the most powerful and accessible steps that individuals can take to reduce their risk of heart disease and enhance overall well-being.
Yeah, Dr. Watson, talk to us then about the impact of tobacco and electronic vaping device use and stress on heart health, and what can be done to address these issues. And there's also a general narrative out there that the electronic vaping devices are better than smoking. So some have resorted to using vaping as opposed to smoking cigarettes. Is cigarette better than vaping, and what can be done to really address these issues in your view?
Thank you. Good question. So, tobacco smoking is still one of the major issues in South Africa, and electronic vaping is also now growing amongst the youth, often marketed as safer, like you've just mentioned. But both of these do increase your cardiovascular risk, and I wouldn't suggest either or. Smoking is bad for you. If we're looking at, how it damages blood vessels, it also raises blood pressure, it reduces oxygen supply to the heart, and it also promotes buildup of fatty deposits in the arteries, all of which contribute to heart attacks and strokes. And this is now not just your generic cigarette smoking, but vaping as well. And then even secondhand smoke poses a serious risk, especially for children and vulnerable individuals. If we're looking at stress also, especially financial stress, unemployment, and crime, it has a huge effect on our heart health, contributing to not just the increased stress hormones levels, but also leads to hypertension, inflammation, and unhealthy coping behaviors like your smoking, poor diet, and also your physical inactivity. Now, to combat these threats, individuals are encouraged to quit smoking, and adopt stress management techniques like mindfulness and exercise, and then to seek professional support where needed. Now, in South Africa, the Heart and Stroke Foundation plays a leading role in raising awareness about the dangers of tobacco, smoking, as well as vaping and unmanaged stress, especially through public education and advocacy. And we also support the implementation of the proposed tobacco control bill, which seeks to reduce tobacco-related harm through stricter regulations on public smoking, also plain packaging, and restricting the tobacco advertising and product displays. But all in all, tobacco smoking and vaping are very dangerous for your health. And it definitely increases your cardiovascular disease risk.
You're really doing a stellar job, Sister Watson, I must say, and your work is very much commendable. But you and I can agree that cardiovascular diseases are the world's leading cause of death, and yet it is preventable. But then the question is, from your nursing perspective, I don't know how long you've been practicing for, but what are simple everyday steps that makes a difference in protecting heart health?
Thanks. Yeah, from quite a lot of experience, I would say. But I think, if we're looking at 80% of heart disease and strokes that happen before the age of 70 years can be prevented by simply just choosing healthy behaviors and treating conditions like your high blood pressure, high cholesterol, and diabetes. So, if we're looking at healthy behaviors, these include your healthy diet, which is rich in fruit and vegetables and low in salt, sugars, and unhealthy fats. It also includes exercising regularly, not smoking or drinking, managing day-to-day stress, and maintaining a healthy weight. Additionally, I would also recommend regular checkups, especially if you have a family history of medical conditions. And then, these small changes in routine, like opting for a healthier snack or taking the stairs instead of using the lift, can make a big difference. Um, I would also say even avoiding going out to the shop or going on an outing without eating a healthier snack at home also helps prevent buying the on-the-go processed unhealthy foods. Um, but I think essentially being mindful is key, and just making small adjustments to your everyday life will definitely help you be healthier.
Mm. I Yeah, and Doc, I know that Sister Watson, I know that your organization, Heart Foundation, is really helping to bridge the gap. But your experience, of course, what are some of the barriers do patients face in accessing heart health services? Whether it's screening, you're talking about expensive equipment, I would imagine, treatment and education. What is more challenging in Africa? What are you seeing? Is it screening? Is it treatment, or is it education, educating people about heart health? Or the question goes even deeper than these three examples I just mentioned.
Yeah, I think there are many challenges that South Africans face on a daily basis. Many patients can't afford regular screenings, or they just live far away from public health facilities. If we just consider someone who is elderly, difficulty in mobility, just for them to get to a clinic it's a big challenge. And then in saying that, poor support systems, and also knowledge gaps about available services, common symptoms, or even early warning signs play a big role in when or how to access these services. So if we look, the Heart and Stroke Foundation, we hope to bridge that gap by providing the education, running awareness campaigns in multiple South African languages, which definitely is essential, and then also offering professional services like our nutrition counseling as well as health risk assessment. We also have many other work streams in which we hope to make healthier choices easier and also health information accessible through our media outreach and our Heartmark endorsement program, just to name a few. But we offer professional guidance through our health chat line as well, and hoping that we do actually bridge that gap where someone will be able to say, okay, I've spoken to this professional person, so be it a nurse or the dietitian, and I've got the advice that I need and I know what to do going forward. So, but there are so many challenges that we all face, and we can't mention them all, but I think it's important that we do identify the challenges that we're currently facing ourselves, but then also reaching out and looking for ways on how we can, overcome those challenges by looking for support in our communities.
Yeah, but just as a parting shot, and thank you so much for this conversation. Just before I let you go, maybe I know that you've spoken about it. Maybe just expatiate a little bit. I mean, we know that beyond the medical interventions, what medical, or should I say emotional or psychological challenges do heart patients face, and how do nurses support them through recovery and lifestyle challenges? How important is that support for these people who are going through these challenges?
Thank you. It's an important question to ask, and I think a lot of South Africans, in general, when it comes to receiving a diagnosis of a heart issue or a heart disease, they do experience fear. Sometimes it can even lead to depression or anxiety after they receive the diagnosis. A lot of patients worry about financial strain being one of the reasons, that they can't provide for their families. Some also fear the prospect of early death or disability. So nurses can play a very big supportive role by offering basic counseling. We also can encourage family involvement, which I think is quite essential to bridging the gap as well, then also helping overcome anxiety. We also help by assisting patients to connect to support groups. Emotional reassurance, like explaining recovery in simple terms, celebrating small progress, like, returning back to daily activities, can definitely help patients adjust to and stick to behavioral changes, which is obviously what we aim for at the end of the day as the patient, after their diagnosis, to try and overcome, daily challenges of what they, are facing in terms of, how do they change their diet, what physical activity they can incorporate, and also after, a very big event like, let's say, heart surgery, it's definitely a long process, and they definitely need all the emotional reassurance and help that they can get.
Dr. Watson, thank you so very much for making the time. I can tell you now that your work is indeed commendable. Please continue.
Thank you so much. It's such a pleasure.